Hello, my name is Lindsay Casper, and this is my presentation on the ethical concern that deals with Jehovah's Witnesses receiving blood transfusion. The Jehovah's Witnesses group is a really important ethical concern to me. I work in an oncology floor, and we've had a few of these Jehovah's Witnesses patients that have made a huge difference in how I treat patients, and I've actually learned to accept and respect their decisions. I wanted to take the time to look into this subject a little more to kind of help me in my future and with blood transfusions and these type of patients, to help me keep continuing to cope and accept their decisions. So to begin, ethical concern with Jehovah's Witnesses. The Jehovah's Witnesses was originally founded in 1872 by Charles Taze Russell. This group remains an ethical concern to the nursing profession and the healthcare field. They strongly believe that blood transfusions are forbidden through their religious beliefs. Many nurses and physicians throughout the world deal with Jehovah's Witnesses on a daily basis. It becomes an issue when a simple blood transfusion would save their life, although they still decide to refuse the treatment because it's against their religion. The big question with this that many physicians and nurses and people in the healthcare field are having a hard time dealing with is, do we just let them refuse a treatment and could possibly die from it, even though we know that a simple transfusion can help save their lives in the long run? This is a big question that a lot of nurses and physicians have a hard time dealing with, and if we have more information and we understand where this ethical concern is coming from, it can allow us to help cope and deal with this ethical concern in a more appropriate way. So what does healthcare workers can do in order to make this decision of the Jehovah's Witnesses patients a little easier? Their responsibility is to treat the person as a whole and respect their decisions and accept what they decide to do, depending if it's accept a blood transfusion or decline one. According to Butts and Rich, patient advocacy is an essential element of ethical nursing practice. It requires that nurses embrace the promotion of well-being and uphold the rights of interest of their patients. However, when caring for Jehovah's Witnesses, ethical and legal concerns for the caregiver and the hospital do arise when we're talking about a life-saving blood transfusion that they may need during their hospital stay. Many individuals that are Jehovah's Witnesses need a blood transfusion to stay alive. This has become an ethical concern in a large amount of hospitals because they can refuse transfusions, and the healthcare field needs to be prepared to deal appropriately with that decision. With the healthcare field growing so much and more Jehovah's Witnesses being into the hospitals in the healthcare field, it's important that healthcare workers know how to meet these ethical challenges when caring for these type of patients. One major way to deal with this ethical concern is through effective communication. Communication is key in all type of aspects, whether it's Jehovah's Witnesses or any other type of issue that occurs. Effective communication allows for full explanation to be given to their patient. They can then make an informed decision if they have the right education and the risks and the benefits that all go into this decision that they have to make. A study showed Effa Heap in 2012 stated, in all situations where a patient refuses blood or blood transactions, maintaining a good rapport with the patient becomes the key to obtaining the best possible outcomes in a difficult situation. It is the nurses and physicians' responsibility to keep that good rapport with the patient and help them in making a decision that they want to make. And it's also, in the end, the responsibility of the nurse and the physician to accept and respect that decision. Along with communication, the caregivers, the nurses, and physicians must be aware of the patient's wishes and rights. Never assume that the members always are going to agree with the Jehovah's Witnesses policies. And make sure you ask each patient separately what their wishes are regarding blood transfusions. And do this in private. Make sure that as healthcare workers, we understand the sensitivity of Jehovah's Witnesses and their decisions, because large ramifications can occur for the patient if we do not respect their patient privacy. They can be shunned from their community, and it's not the job of the nurse to be able to make sure that that happens and continue to respect that what they wish in their privacy. Each Jehovah's Witnesses has their own freedom to choose for himself or herself. There are many variables that can have an effect on the decision of blood transfusion in Jehovah's Witnesses. Those can include age, situation, and consequences that can occur. The first variable issue we're going to talk about is the age of the Jehovah's Witness. Although age can be a very hairy subject in a lot of legal issues, especially in Jehovah's Witnesses, many legal and ethical issues can occur with age. The parents may refuse treatment for their children at certain times. If there is a conflict, however, medical ethical teams can intervene and decide what the best decision is for this child at this right situation. This is mainly for the child's safety. 16 to 18 years old is a little tricky with the Jehovah's Witnesses. If they are deemed sufficient to make their own decision, they can then go ahead and decide if they want to accept or reject blood transfusion and make their own decision regarding this situation. The last variable issue I'm going to talk about is the consequences that can occur if they decide they don't want the blood transfusion. If they decide they don't want the blood transfusion, they can be shunned from their church and they are asked to be removed from their group as a Jehovah's Witness. Consequences are a huge issue for Jehovah's Witnesses because that's their lifestyle, that's how they've grown up, and that's where their family oftentimes is. If they look at the consequences and the actions of accepting a blood transfusion, this can then become a very important variable issue. Many physicians and nursing leaders have a difficult time accepting the Jehovah's Witnesses' decisions to refuse a life-saving blood transfusion or just a blood transfusion in general. We looked at a study that showed that individuals who underwent ethical classes in school were more understanding of Jehovah's Witnesses. With that said, I think it's important that physicians and nurses undergo a class or two in their undergrad or their certain classes that help them cope and respect these decisions later on in their career, and they deal with them in the classes and are able to deal with them appropriately when they're dealt with them in a real situation in life. Phil Wilson discussed in an article how to help nurses cope with the decision making regarding Jehovah's Witnesses and their children. Phil Wilson stated that family-centered care is extremely important in the nursing field. Being able to respect the family decisions and communicate with the family and the patient, provide them with education in order for them to make a sound decision regarding blood transfusions. These are the references that I've used to make my presentation. I hope that my information and my presentation has allowed you to get a good understanding of the ethical concern of Jehovah's Witnesses, and I hope you can take this into your practice in the future. Thank you for listening.
You're welcome.